Hello guys, I am KHUSHPREET Singh. I am a student of Kharkiv National Medical University. I am studying in 5th course. Today we will discuss the topic of Marfan Syndrome. First of all, the introduction. A person, Anthony Bernard Jean Marfan, who was born on June 23, 1858. In 1986, Marfan described a hereditary disorder of connective tissue in a 5-year-old girl with disproportionately long limbs that later became to be known as Marfan Syndrome. So now is the definition. What is Marfan Syndrome? It is a connective tissue disorder that affects body growth, connective tissue, which provides support for skeletal structure and all organs of our body. And Marfan syndrome, also called Marfan syndrome, result from a change in the fibrillin 1 gene. It's often but not always inherited, and any disorder that affects our connective tissue like Marfan syndrome can affect your entire body, including your bones, your muscles, skin, eyes, blood vessels, heart, and other organs. And a person with the Marfan syndrome may be unusually tall and slender, have loose joints, and have a problem with vision, the heart, and the other health issues. Its epidemiology: incidence is reported to be 1 in the 10,000 live births, and approximately 1/4 of cases are sporadic. And the disorder shows autosomal dominant inheritance with high penetrance but variable expression. Both interfamilial and intrafamilial clinical variations is common, and there is no racial or gender preference. Marfan syndrome is associated with abnormal production, matrix deposition, or stability of fibrillin 1. Fibrillin 1 is a glycoprotein component of the extracellular matrix protein that is the major constituent of microfibrils, and the extracellular matrix is critical for both the structural integrity of connective tissue but also serves as a reservoir for growth factors. And the Marfan syndrome was traditionally considered to result from a structural deficiency of connective tissue. The fibrillin 1 locus reside on the long arm of the chromosomes 15, and the involvement of fibrillin 1 has been demonstrated in more than 90% of cases. Their clinical manifestations: Marfan syndrome is a multi-system disorder that cardinal manifestation in the skeletal system, cardiovascular, and the ocular system. In the skeletal system, the disorder show itself differently in different people. Like, the visible symptoms occur in bones and joints. Visible symptoms may include like the unusually tall height, a slender body, long fingers and toes, as you see in the pictures, fingers that person can't straighten out, and the anterior chest deformity outwards like pectus carnitum, or the flat feet, loose and the flexible joints, or a curved spine known as scoliosis, stretch marks not related to weight changes, especially on the shoulders, hips, and lower back, or the overgrowth of the long bones like the dolichostenomalia, or a little fat under the skin. In the cardiovascular system, we see the aortic aneurysm, dissection, and rupture principally at the level of sinuses of Valsalva, which is the aortic root, and the most life-threatening manifestation of Marfan syndrome. And this thickening of the atrioventricular valves is common and often associated with valvular prolapse. And in children with early onset and severe Marfan syndrome, insufficiency of the mitral valve can lead to congestive heart failure, pulmonary hypertension, and death in infancy, or the dilated cardiomyopathy. Also, the aortic valve dysfunction and the dilation of main pulmonary arteries is common, and enlargement of descending thoracic or abdominal aorta can also occur, although relatively rarely. And in the ocular system, people with Marfan syndrome often have eye problems. About 6 in 10 people with this condition have partial lens dislocation in one or both their eyes. And eyes problem you may be more prone to if you have Marfan syndrome include like nearsightedness, cataracts, glaucoma, displacement of the lens of the eyes, and unusually flat cornea, or limited development of the iris, the colored part of the eye, the retinal detachment, where the light sensitive cells at the back of the eye, known as the retina, and pulls away from the blood vessels that supply it. And people with Marfan disease should seek treatment for eye problems as they can lead to vision loss. And there are some other system like widening of dural sac root sleeves is present in 60 to 92% of Marfan patients. And another common manifestation is congenital or acquired inguinal hernia, pulmonary disease in Marfan syndrome. Widening of the distal air spaces predisposes patients to the spontaneous pneumothorax, which occurs in up to 15% of patients. And most common skin finding in stretch marks like pinkish scar like lesions that later become white striae. There are some other spinal problems before the diagnosis, like the increase in the curvature of spine and known as scoliosis. This can lead to the back pain and breathing problems. And there is also higher risk of spondylolisthesis, where one vertebra, a bone in the spine, slips forward over the another one, and it usually affects the lower spine and can lead to stiffness and pain in the back. And there are also lung and chest problems, like person may have a protruding or sunken chest. In some cases, air may accumulate near the top of the lungs, which may result in the collapsed lungs. Now it's the diagnosis. Like usually there is no test for Marfan syndrome, but before making a diagnosis, a doctor will usually start by considering any symptom or features, asking about your family history, doing a physical exam like wrist and thumb sign or pectus carnatum deformity, hind foot deformity, and using these criteria known as the Gantt nosology, doctor will give points for features like scoliosis, flat feet, problems with the aorta, and the score will help decide if a person likely to have Marfan syndrome. And there are also some typical exams like an MRI scan, CT scan, or X-ray to look over lower back problems, an echocardiogram to look over unusual features in aorta and valve problems in the heart, or an electrocardiogram to assess the heart rate rhythm, and an eye exam to assess your eyesight, and other screen for cataracts, glaucoma, and other problems. And the doctor may suggest genetic testing to see if a change is present in the fibrillin gene, but not everyone with this change will develop Marfan syndrome, and even if the change is present, it won't confirm a diagnosis. So there are some differential diagnoses like aortic aneurysm syndromes like Loeys-Dietz syndrome, and the familial thoracic aortic aneurysm, and the Svensson-Goldberg syndrome, SK gene, fibrillin 1 gene, and the ectopic lentis syndrome, which is male, Murchessi syndrome, and the homocystinuria, familial ectopic lentis, and syndromes with the systematic manifestation of Marfan syndrome like congenital contractural archaeodactyly, fibrillin 2 and mass, mitral valve prolapse, aortic enlargement, skin and skeletal findings syndrome, fibrillin 1 gene. In laboratory findings, like most if not all people with classic Marfan syndrome have fibrillin 1 mutation, the large size of this gene, the extreme allelic heterogeneity in Marfan syndrome have frustrated efficient molecular diagnosis, and the yield of mutation screening varies based on technique and clinical presentation. Their management focus on preventing complications and genetic counselings, and yearly evaluation for cardiovascular disease, scoliosis, or ophthalmic problems are imperative. If we talk about current therapies, there are some activity restrictions like physical therapy can improve cardiovascular performance, neuromuscular tone, and psychosocial health, and the aortic surgery. And aortic surgery should be recommended for adult patients when their aortic root diameter approaches 50 millimeter. And in pregnancy, prophylactic aortic root displacement can minimize the risk of aortic dissection and death in women with Marfan syndrome who wish to become pregnant. And in endocarditis prophylaxis, the National Marfan Foundation believes that the patient with Marfan syndrome should continue to receive prophylaxis for bacterial endocarditis, in part because it remains unknown. And current pharmacological approaches for like beta blockers have traditionally been considered to standard care in Marfan syndrome. Multiple small observational studies suggest there is a protective effect on aortic root growth. And in emerging therapeutic strategies, it is angiotensin 2 receptor type 1 blockers named losartan. There is extensive evidence linking angiotensin 2 signaling to the TGF beta activation and signaling, and retrospective studies assessing the effect of angiotensin 2 receptor type 1 blockers in a small cohort of pediatric patients with Marfan syndrome who had severe aortic root enlargement despite previous alternate medical therapy showed that the angiotensin 2 receptor type 1 blocker significantly showed the rate of aortic root and the sinotubular junction dilation, both of which occur in Marfan syndrome. Before the prognosis, there are some cardiovascular symptoms and the bone and joints problems. Like in the cardiovascular system, beta blockers like propanol and etanol can help treat cardiovascular systems. They can lower the pressure on the cardiovascular system by reducing strength and frequency of heart contractions, and a doctor will closely monitor their use and may adjust the overdose time and dose over time, and but they may not suitable for everyone, like for example those with depression or asthma. And if we talk about another option, maybe angiotensin receptor blocker like losartan, and there's evidence may help some people with Marfan syndrome, but still the research is ongoing. And experts also recommend an ECG at least once a year to monitor heart health, and in some cases surgery may be necessary. And in bones and joints, a doctor may prescribe a orthopedic brace if you have skeletal problems like scoliosis, and some people may have surgery. They may do this for cosmetic reasons or if there is a risk of medical problems. And in eye problems, like a regular eye exam can help detect correct visions problems. Experts recommend a checkup at least once a year, and possible interventions include like wearing eyeglasses, using contact lenses, surgery in some cases. And a person with Marfan syndrome may need to avoid sports activities that involve a risk of head trauma like football or boxing, and they should wear a protective gear if their work or other activity expose them to be possible injury. And there are some other concerns, like statistics how show that people with Marfan syndrome are likely to be experience like pain with which affect 42 and 92% of people with the condition, and their limitations on physical activity they and also reduce the endurance, and they give anxiety and depression, and these all can affect a person's quality of life. And if we talk about prognosis, in the early diagnosis and refined medical surgical management has greatly improved the prognosis for patients with the condition. And in the more classic form of Marfan syndrome, it is estimated that more than 90% of individuals will have a cardiovascular event during their lifetime. And in a review of 54 patients diagnosed during infancy, 89% had serious cardiopathology, standard care, and their cardiac disease are progressive despite standard care. 22% died during childhood and 60% before the age 1. Thank you for the attention, guys. See you next time.